think Project Zero from the City of New York is here. Martin Horn, is there Patricia Brennan with you? You must be Patricia Brennan. Grant, thank you both for coming.
Good afternoon. Our innovation began with the recognition that an honest appraisal of the long-term consequences of confining juveniles demonstrates its destructiveness. The administration of juvenile justice in our country is marked by an absence of coherent leadership and is essentially unmanaged. Project Zero represents our resolve to take advantage of that vacuum and change the paradigm in New York from the bottom up. New York's juvenile justice system was two-dimensional. The only options for judges dealing with adjudicated delinquents were return to the home or residential placement. Removing a child from the home doesn't improve the family's capacity to raise the child. It disrupts the child's education, teaches the child the wrong skills, and stigmatizes. It should be reserved for the few children so damaged as to be dangerous, for whom nothing else will suffice. The city and state were each spending $80 million annually on residential care of juvenile delinquents, and 81% were rearrested within 3 years. We were spending a lot of money to make kids worse. People speak of a cradle-to-prison pipeline in minority communities. It makes an express stop at the family court. Probation sits at the information crossroads of the juvenile justice system. From that fulcrum, we embarked upon our goal: 0 New York City kids sent to out-of-city placement. From the work of others, we learned that structural reform has to be coupled with deep cultural change. Solutions can't be imposed from the outside. Good innovations arise inside government and resonate with the values and culture of the staff who make government work day in and day out. We found decision points where we could change practice and policy. We resolved to be data-driven and accountable for the results. The data demonstrated the most significant factor in determining whether a judge sends a child to placement was the probation recommendation, and probation officers were idiosyncratic in their decision-making. We created a research-validated instrument to guide sentencing recommendations, achieved consistency, and the results were immediate and dramatic. From 2004 to 2007, placement recommendations declined from 40% to 18%. Placement admissions declined from 1,257 to 795. Probation has the power to divert cases at the time of arrest. Using consistent decision-making tools and structuring the interactions, we increased the number of cases diverted by 206%, from 1,070 in 2002 to 3,271 in 2007. While juvenile arrests increased by 3,500, the number of cases going to court increased by only 412. Our alternative to detention program, designed 30 years ago, was based on a flawed model, enrolling kids who would not otherwise be detained while seriously compromising their school advancement. We closed it down. This propelled efforts to design an evidence-based tool to determine risk of reoffending and failure to return to court. The risk assessment instrument has become part of everyday practice in family court. Detention of low-risk youth has declined by 53%. We made the system three-dimensional. We created Esperanza, placement in the community with evidence-based supportive services, working with the family, keeping the child in school, and working closely with the PO. Based on our success, the city invested $11 million to expand similar community placement services, and this year the state proposed closing 6 residential facilities as a result of the reductions we achieved. Faced with a 41% increase in juvenile arrests from 2002 to 2007, we have reduced the city's use of placements by 37%. The mayor's office projects $43 million in savings over the next 4 years. This change is here to stay. The costs are too high for the city or the state to turn back. Our staff, judges, the bar, community-based organizations have embraced this change and have a stake in its future. Last month, the city began weekend court processing for arrested juveniles. Project Zero drove that change.
That was a nice way to wind that up. I saw you watching the clock. Thank you for a very good
I'm going to ask Pat Brennan to join me.
Oh, yes, good. Questions? Yes, David.
It's very clear that your project saves money. Your application also says it makes New York City safer.
That's correct.
And I couldn't find any data in there that supported that, so I wondered if you could prove that to us.
As a matter of fact, I can. There was a study done by the New York State Division of Criminal Justice Services that found that within 9 months of release from residential placement in state-run facilities, more than 50% of the young people were arrested within 9 months. Our Esperanza program, which, by the way, is limited to children who are otherwise bound for placement, reduced that, and for kids in the first 9 months following completion, only 16% were rearrested. So we went from a 50% rearrest rate to a 16% rearrest rate.
How many kids is that? I mean, how many kids are in that program?
Over 400 kids. Over 400 kids.
Per year?
Since the program began.
Yes.
It's striking to me how we've had 3 now programs dealing with corrections, juvenile offenders, and they're all moving in a very different direction. Is there something? Have we gotten it wrong? I mean, you said 30 years ago we got the wrong policy. Have we sort of misunderstood what the nature of correction should be, or is this a new experiment that people 30 years from now will tell us, well, we got it wrong. We were soft-headed back there in 2008 or so.
The president of the Casey Foundation, Douglas Nelson, once said, let me quote, "No area of domestic policy has been so thoroughly abandoned to misinformation, emotion, and disregard for consequences as the area of juvenile justice." And I think that is why there is so much ferment in the area. We are now realizing, when we take a look at the numbers, when we take a look at the data, the conclusion is inescapable that what we have been doing doesn't work.
Was that the end of your original speech?
Excuse me?
Did you just very creatively draw upon the end of your original speech?
If I might, Ms. Brennan and the commissioner gave reference to it, but I still had I'm still having a little bit of difficulty completely understanding what Esperanza is and kind of the role.
Okay.
Pat, can you?
When we began, a judge, as I said, it was a two-dimensional system. The judge could either keep the child home or send him to residential placement. It was two-dimensional. What we did was we said that we created Esperanza, which is a community-based, intensive care model using evidence-based practice, multi-systems therapy.
Is it an NGO? Is it governmental?
It is a private organization under contract to us. We put out a contract that led to its creation. And we avoid net widening because a child is not considered eligible for Esperanza unless and until a judge has ordered residential placement, at which point we come in and intervene with the community-based alternative.
I'm a little unclear about the entry point. Because I don't think we had these statistics in your application, but from what you said, there are substantially more juveniles being arrested, 3,500, I think, and
yes.
then only 400 of that increase are being then recommended for adjudication, so
yes.
that they're being adjusted at intake at a much higher rate. And then to David's question about that's increasing safety. What happens, those 3,100 juveniles who are diverted at that point, what happens with them? Are they sent to are there conditions on that diversion? Are they simply recommended not for prosecution,
Yes.
or what?
Yes, under New York State's Family Court Act, our agency, the Department of Probation, has the responsibility to screen all newly arrested cases before they appear before the judge. We have the authority to impose what we refer to as non-judicial sanctions, and so we can work with the young person for up to 180 days?
2 months to 4.
2 months to 4 months, I'm sorry. And during that time, we can do casework, we can refer for mediation. A lot of the cases that we see and a lot of the reason for the arrest is that as crime has come down in the city, the police department has reached deeper and deeper into the barrel. And so we speak about quality of life crimes. So you're seeing a lot of arrests being made and a lot of young people coming into the system for very minor offenses.
But those 3,100, the net difference, those 3,100 are all being sent home.
That's correct. They're never entering the court system.
So there's a disconnect somehow between the arrests, additional arrests that get made, and those that you think are worthy of at least review by a judge.
I'm not sure when you say a disconnect. We believe, and the city law department, which is responsible for prosecuting cases as well, that these cases can be resolved through mediation, through restitution, through sometimes simply saying I'm sorry, through removing graffiti. They don't require the intervention of a judge.
Okay.
Good. Well, time is up. We thank you. Bill Klinger, did you have a brief question?
There seemed to be some tension between the city and the state in terms of the state's willingness to participate in or fund alternative systems. What's that all about?
How much time?
How much time you got?
I guess
yes, that is correct. There is a tension. It has to do with the funding, and it has to do with how the savings get reinvested, right?
Good.
Thank you.
We thank you both very much. We return now to the Commonwealth of Pennsylvania for Access Plus, Michael Nardone, I hope that's correct, and David Kelly.
Very good, thank you. Thank you for the opportunity to present our innovative Access Plus program, and thank you for welcoming a Woodrow Wilson School graduate.
We're not going to hold that against you. We pledge we will not do that.
In 2003, the administration of newly elected Governor Rendell charged the Medicaid program with developing a new model of care in areas of the state, many of them rural counties, where Medicaid managed care had not been implemented and where the traditional Medicaid fee-for-service system had gone unmanaged. A model that improved access and quality of care, but also was cost-effective for the taxpayers. We responded with Access Plus, an enhanced primary care case management model for both children and adults that focuses on finding Medicaid consumers a medical home. In our model, the state continues to assume the risk of medical claim payment while leveraging the expertise of a vendor to do primary care case management and disease management. Our program is unique in many aspects, including its intensive focus on care management, its dedication to assessing quality and access to care, the integration of pay-for-performance into the basic payment system, and the use of enhanced health information technology to support program objectives. The new approach represented a major paradigm shift from the previous administration's efforts to move all Medicaid recipients to a capitated full-risk HMO model. The program also follows closely the governor's health care reform initiative, Prescription for Pennsylvania. In just 24 months, the Access Plus initiative has transformed the traditional fee-for-service program. We have established a medical home for close to 300,000 recipients and disease management programs for about 35,000 individuals. We've become the first fee-for-service managed care model to annually measure nationally accepted quality parameters, member satisfaction, provider satisfaction, and program cost savings. And we've implemented vendor and provider pay-for-performance programs to incent continued improvement on these quality measures, among other innovations, all with the goal of improving health care outcomes for our MA consumers. Dr. Kelly?
We have demonstrated our program improves the quality of care, improves satisfaction of providers and consumers, and saves money. Nationally accepted quality measures showed significant improvement in diabetes care, asthma care, and general access to preventive services. Consumer and provider surveys showed very high satisfaction with our program. Our comptroller's office conducted an independent review that drew the same conclusions. Independent assessment by Mercer Government Consulting Services demonstrated significant cost avoidance in the first and second year of our disease management program. In essence, for every dollar spent on the program, $2 were saved. They also found that medical costs and administrative costs were significantly lower than Medicaid managed care costs. The Access Plus program is significant because it offers a new effective approach for states currently struggling with increasing Medicaid enrollment and increased health care costs. Nationally, health care costs have risen dramatically, outpacing the rate of general inflation. By focusing on the needs of patients with chronic disease, our program has blunted the medical cost trend. We have implemented on large scale many of the components of the chronic care model. We have developed pay-for-performance programs that are on the cutting edge and align provider and payer incentives focused on the quality of care for our consumers. We've transformed into a service organization dedicated to serving our customers and providers in partnership with our vendor. We have established provider and customer service units, a 24/7 nurse advice line, and 4 regional advisory committees made up of consumers and providers to guide and further development of our program. Lessons learned from the Access Plus program can and have been transferred to other programs in Pennsylvania and around the country. Pay-for-performance programs first implemented in the Access Plus program have now been extended to our 7 managed care HMOs. The Pennsylvania Department of Insurance is looking to the Access Plus medical home model as it develops a new program to expand coverage for the uninsured in Pennsylvania. Because of our success in demonstrating measurable outcomes, other states frequently contact Pennsylvania for information about the Access Plus program. States such as Illinois, Washington, California, New York, and Texas. Some have incorporated components of our program into theirs. By participating in national care management learning groups, we have been able to share our program with many state Medicaid programs and other purchasers of health care. In summary, our innovations in care management, quality improvement, pay for performance, and the use of technology have transformed Pennsylvania's Medicaid program and have helped other states design their programs. Thank you for the opportunity to showcase the Access Plus program.
Thank you very much. Kathleen Kennedy Townsend could understand every word of what you just said. I couldn't. Can you help me just with like a 30-second? What does this mean for an average family on Medicare to have a Medicaid, to have a medical home, or how is life different for a Medicaid family? If you could just, without the jargon, if you could help me with that, I'd really appreciate it.
Mr. Chairman, if it helps you, I'd asked him earlier to give me the Forrest Gump sort of interpretation. and I assured him, I promised him he could not dumb this down enough for me. So in that spirit, if you...
I think the essence of a medical home is that as a patient, I'm able to contact my provider, whether it's a doctor, a nurse practitioner, or whomever. I have a relationship built with that provider that I can get all of the services that I need. Working with our disease management and care management vendor, they can help arrange and coordinate care. They can help me as a consumer get to my doctor's appointments.
It's like having an internist.
It's like having an internist.
It's like having a doctor you can go to as your gateway into other.
That's right.
It's a one-stop where you can get access to others. Is that the point?
Yes.
And they didn't have something like that before?
Correct. It's to help coordinate care. And again, we focused on not just adults with chronic disease, but we also focused on children so that they could get in and get their immunizations, get their lead screening done, all the preventive services that we know lead to better health outcomes.
But they can go essentially to the same facility each time, and they've got a person or a team there that they
Absolutely.
can go to. Okay.
Yes.
And I would just add that another big piece of our model is the use of pay for performance, where providers who basically are getting patients in for well and preventive visits, as well as doing the chronic care disease management around, say, diabetes, where the diabetic is getting some of the preventive upfront care that they need rather than having to go to an emergency room down the road because they weren't getting the screening, they weren't taking the medications that they needed to take, and basically building into the way we pay the primary care doc that they are rewarded when they basically work with the patient to do those things.
And you can save money doing this?
Yes.
Yes. Okay. Maria?
So I, too, had trouble figuring out what a medical home was, but in some ways, in sort of middle class or people who have sort of full health insurance, you end up managing your own care in a certain way. You have a practitioner, but you take it upon yourself to take the children for the vaccinations, whatever. So what you're essentially part of what the innovation here is, you're recognizing that for a certain part of the population, they are not actively managing their care. And because you've got Medicaid, you have an opportunity to find some ways in which they're doing what they need to be doing. Is that a way of trying to describe it?
We're helping them to optimize their care. So we're giving them additional resources. They may not have the resources to pay for transportation to get to their doctor's visits. So we're providing those additional resources. We're helping them connect the dots with the primary care physician and the specialist or the dentist. So we're helping to connect the dots. Philosophically, though, we really feel that our patients can be just as engaged as anyone else in the management of their health care. And that's why, again, our disease management programs are very focused on patient engagement and getting them involved in their care.
David Osborne and then Nancy Johnson.
There's two things you talked about that sound great, but I can't tell from the write-up or what you said really what they consist of. So could you tell us how the pay-for-performance program works? And secondly, your measurement of quality. What do you do with that information to improve quality?
Okay. As far as the pay-for-performance goes, with providers, for instance, if you as a doctor do all of the right things, working with the patient and getting the right care for diabetics, you will get paid about $300 more, above and beyond your traditional fee-for-service payment for a doctor's visit. So we're rewarding doctors to take care of the sickest patients and get the right care done. In essence, that's what the pay-for-performance program is with providers. We also, with our disease management and care management vendor, we have similar quality parameters that we hold them accountable to, and they can either be penalized or gain additional bonuses depending on how they perform.
So, for example, we use a measure around emergency room utilization, and basically benchmark that and look at decreases in emergency room utilization under the theory that that is basically the person going into a primary care doctor and avoiding the need to go to the emergency room, which is one of the benefits of having a medical home.
And we significantly reduced that in the second year of the program. Your other question, second question was around the quality measures.
Quality measurement to improve quality?
We collect HEDIS-like data measures, which are nationally recognized measures. We actually share those results with our consumers and with our providers. They are publicly available. We're actually working on a consumer guide that will share a publication that will share those quality results. So we not only collect the results, but we actually develop new programs. For instance, we noticed that our cervical cancer screening rate was not very, was lower than what we wanted it to be. So we actually put together, in the first year of measurement, we realized that. So we put together some quality improvement projects around that in certain counties. In those 3 counties that we put those projects together in, there was significant improvement. So that's how we use the data that we collect to change our programs.
Time's up. Nancy Johnson has a question.
And by providing the patients in your system with coordination of care and disease management, do you save enough money from unnecessary emergency room visits and hospitalizations to pay for all this? And what's the difference between what you're doing and what some of the other states are doing?
We are
for the
saving,
same purpose and with roughly the same tools.
We are saving money, and it's mainly through reduction in emergency room use, through establishing a medical home, and also folks with chronic disease. They tend to not go in the hospital more, so we're avoiding hospitalizations. Those are the two main areas. As far as what are we doing differently than other states, we've combined the Pay for Performance program with providers to incent them to do the right thing. So that is different than what other states have been doing. And we've been out front. We've shared our program with many state programs.
I would say that the major difference is the comprehensiveness of our initiative. In effect, the state is acting as a Medicaid HMO, using the expertise of various vendors as well as our own state staff to improve health outcomes and being able to do that in a nimble way.
Yeah.
That helps a great deal. Thank you both very much.
Thank you.
On to another Commonwealth. Now Virginia. Knowledge Management with Gary Allen and Maureen Hammer.
Good afternoon.
Good afternoon. Whoa.
Excuse me.
No, that's great.
Wake us up.
Yeah, you did.
Maureen and I are absolutely thrilled to be here. Thank you very much.
Thank you.
Government at all levels faces a looming giant. We just haven't been willing to admit it. That giant is the loss of knowledge and know-how in terms of providing public service. It's what's in people's heads, not what is written down in rule books or guidelines or specifications. The V.KM program, the Knowledge Management Program, is designed to help address that issue. We believe that a program similar to this can be applied at all levels of government. What we try to do is to capture tacit knowledge, what's up here, harness it, share it across geographic regions and across generations of employees, retain critical human capital in the process, and improve the way we do business through communities of practice. We believe this is the key to the future. It has to be. The days are gone when employees will stay 30 years, and we are facing a period of time when many, many baby boomers will retire at once. Is the program effective and productive at VDOT? Absolutely. As an executive at VDOT, I can tell you I've lived through 2 early out programs that took 2,500 employees that were key managers and designers and engineers. It devastated us for 10 years. We can never go back to that. We can't afford to. The first community of practice we developed, we did it on our own. It was called the Mega Project Managers Group. It was the group of construction project managers, each of whom had a project that was valued at more than $1 billion. If you can save 5% by getting a group together to talk about the issues they face, and they all face the same ones, that's a lot of money. It's a lot of money. That's what we did. And we, in fact, found that they loved to share their daily work, but they'd never done that before. They never talked. We've engaged more than 800 employees in communities, in 40 communities of practice across the Commonwealth. In your packet, I'm sure you've seen some of the examples. Right-of-way resource sharing across geographic regions had never been done. That's saving us more than $1.5 million a year. Weekly pushes of the construction project managers are sending out lessons learned that are improving the quality of the program and reducing the time it takes to deliver projects. Can the program be replicated? I'm absolutely convinced it can be. We started very small. I stole money from my IT budget. I took vacancies from elsewhere in my program, and we worked over the course of the last 3 or 4 years to make this program work. Without a doubt, it's based on proven techniques and tools that we can share with anybody. Maryland DOT and Washington DOT are already moving toward these programs and establishing their own. Many other DOTs have contacted us. I won't go through that list. But this is not just for transportation. The FBI, the U.S. Air Force, the Navy, corporate services in the city of Seattle, the city of Austin, Texas, Detroit, Michigan, and international programs such as the Israel National Roads Program and the London Underground Transport have all contacted us. We're very proud of this program, but more than that, we're excited because of its potential applicability to address this looming giant of loss of knowledge. Thank you.
Thank you. Tony Williams.
A constant question. Looking through the materials in the presentation, I was really looking for a connection between what you're doing and some outcomes, transportation outcomes for the state.
Let me give you.
Is it too early to make that linkage? I saw increases in the number of people participating, those kinds of internal things, but in terms of real outcomes.
Yes. Let me point out that in 2002, we were delivering fewer than 30% of our construction projects on time. Now we are delivering 87% of our construction projects on time. Now, I've been in the research business for 30 years. We haven't done an independent study to prove that the KM program is the only variable that's affecting that. But I know from looking at who is involved in the communities of practice that those communities are consisting of core business groups, including project inspectors, construction managers, construction designers, and so on.
Thank you.
Yes, sir.
I'm having a little trouble trying to understand concretely what these communities do. I understand they come together and they maybe have dinner together or have a day together. But is there a product? Is there a work product? Is there something on paper? Do you run executive programs? You know, universities we would like to think that we do something similar, but we then run executive programs with case studies and the like. I mean, something's written down. I can't quite tell
I'll allow Dr. Hammond
how this works.
Yeah, what happens is we bring the group together quarterly. It's supplemented with an online community of practice team room. They do have specific assignments. In order to get these people who have never been in a room together before to share what they know, you need to give them a focus. And their focus is on identifying the challenges and opportunities that they face and coming up with an action plan that is going to address those. We have a combination of...
Sorry, hold on. Are these people who are they're still on employ?
Yes.
They're senior people?
We've got people who are long-term employees, but we also have people in the group that are new employees coming in.
But they're coming together and comparing notes on how best to do right-of-ways?
Yes.
Why weren't you doing that all along? I guess I don't understand. It seems to me, most businesses do that.
In large organizations, whether they be public or private, there is great inertia, number one. Yeah. Number two, transportation in particular is very risk-averse, very conservative. If you get your name in the paper, that's one thing. But if you get your name in the paper because a bridge fell down, you don't have a job. Okay, so the conservative nature of the business is one aspect. In the Commonwealth of Virginia, we are distributed over 100 counties and 100 cities. We got the largest transportation network in the country, second to California and Texas. And it's very difficult for people physically to get together and share information. Also, there's a question of trust.
Okay. So they come together and have these conversations about right-of-ways. Then what happens?
So then they come up with the solutions. We take them to a decision-making body who then verifies that that's fine or makes their adjustments to it, and they go forth and they make those adjustments. But in the process, what they're also doing is capturing lessons learned, developing best practices, figuring out succession planning. How are they going to transfer the knowledge better to the rest of the organization that needs to be out there, and what needs to be captured explicitly and what needs to be shared verbally.
So you said your third took New York and California. Do you sit down with people in New York and California and compare notes about best practices across states?
I'm sorry, I didn't hear that.
I didn't hear your question.
You sit down and compare notes on best practices in transportation across states beyond your own state borders?
Not as part of this program.
But we're getting ready to engage in a major research program on innovative bridge practices and bridge monitoring. They specifically came to us to have us set up a community of practice going across the 50 states and with the counties and the MPOs to share what needs to happen and what works and what doesn't.
But the Department of Transportation at the national level doesn't bring people together to talk about how to build bridges? I just find this all very revealing.
Yes, they do. They do bring people together to talk about that. But if you look at state DOTs, you will see differences in materials and differences in specifications as you move across the country.
It's eye-opening. Other people who Kathleen
has been historically more related to funding and funding only, just because of scarcity of resources. And I mean, whether they're there or not, I think this has great potential and great need, David. The only thing I would ask you, in your confusion, I think why they've not done it before, is to think of the same conversation we had with the Admiral earlier about the Navy, essentially. I mean, our maritime force is operating without this information, just because they did. You have all these silos in the Texas Department of Transportation. I don't know how many districts we have, but you spend your career getting to be a district engineer. Because when you get to be a district engineer, you do it the way Ron Kirk wants to do it.
Yes, sir.
I waited my 25 years. And now I'm district engineer, we're going to do it my way. Okay. And
the only other point I would make is that you're more successful working with within your own circle of influence than trying to eat the elephant all at once.
These are not hotbeds of innovation, typically. I applaud you for what you... And they also went through a radical approach to funding that they can't say in Virginia, that they had a leadership at one point that decided they didn't need any money for any high.
Well, that's helpful.
Now they need more. So.
Kathleen?
Yeah, so I think we were stuck with trying to figure out what the innovation was. And if I can repeat, what the innovation is that you've had a large department spread all across this great state of Virginia, and somebody would decide how they would do it in Leesburg, and somebody would decide how they would do it in Roanoke, and there would be no conversation between because they were each in charge of their own department.
Absolutely.
And what you've decided to do is bring Roanoke and Leesburg and Arlington together to have a discussion so that there's broad-based understanding of how you solve a particular problem.
And then we close the loop. We close the loop because I report to the CEO. We make sure that we don't let those recommendations lie fallow.
Well, then you do it, but it's not just done because Mr. X
Absolutely.
in Roanoke says it. He has to work or she has to work with it. Got it. I get it.
Okay. You all have been very enlightening. I'm sorry I started out with a few cobwebs. Are there any other questions? But you've been very enlightening. Thank you very much. Yes.
Thank you.
We're moving to another Commonwealth of Massachusetts, MassDOC's Judith Jacobson and Joanne McGurk. Is that right?
That's
Joanne McGurk?
Right.
Okay,
Yes.
Terrific. Judith.
Thank you for the opportunity to talk about MassDOCs. MassDOCs simplifies the financing of affordable housing. Through MassDOCs, multiple funding sources are delivered to an affordable rental development using a single set of streamlined documents that are automatically generated using a web-based system. Before I go into more detail and tell you how MassDOCs has changed the affordable housing world in Massachusetts, I'd like to put the program in context. The role of government in housing in housing lower-income Americans has evolved over the years. As we moved beyond the public housing model, housing built by public entities exclusively with public funding, to programs that encourage private investment in housing, we increased the complexity of the system exponentially. Today, the federal government's biggest resource for affordable rental housing is a tax credit for investors. Private investment is clearly a positive, but tax credit developments are extraordinarily complicated, with a small army of professionals needed to advance each project. Massachusetts is at the forefront of addressing housing issues, but we are not unique in having state programs to write down high land and construction costs and supplement limited federal resources. Like many other states, we utilize programs to incent the private sector to meet housing needs that the market would not otherwise address, housing for special needs populations, for example. It is against this backdrop, what is called layered financing, lucrative for consultants, but slow, expensive, and frustrating for everyone, that MassDocs was developed. So what does MassDocs do? Can something as benign and frankly kind of dull as loan documents really influence policy, change the way government does business, and help us achieve the mission? We think yes. Let me tell you why. First, we took the loan documents of 11 different state programs and melded them into one. We focused on the areas where there were differences and found places where we didn't have to be different. We standardized reporting requirements and the like to make it easier for both government and property owners. We eliminated the confusion that came from having multiple affordable housing restrictions. This is what we're all in it for. How many housing units and for whom? Through MassDocs, the requirements are readily apparent from an at-a-glance composite chart, so there is no question as to who the project beneficiaries will be. We created a participation agreement establishing the relationship between the funders so we'd never have to talk again about issues like who's in third position and who's in fourth, and we called it a global agreement so that once signed, it would be applicable to all future transactions. We branded our program with a name and a logo and documents that are form-like to send the message to developers that these are standard documents, so let's not waste time negotiating them. And we made use of available technology. Our closing attorneys log onto a website, answer a series of questions, press a button, and customized documents are automatically generated. It's kind of like TurboTax. MassDocs allows for local funding as well. Many municipalities receive federal funding directly or have their own local programs. We now have 11 participating municipalities, including the City of Boston, and I'm confident the numbers will grow. When our Innovations Evaluator came to visit, it was quite gratifying to hear the local officials we gathered say that joining with the state through MassDocs made them feel more powerful. And we're saving money. Our initial data shows cost savings on legal fees on average of about 20% per closing. MassDocs is applicable to rental developments. We do have plans to expand it to home ownership, but focusing on rental is by design. As the subprime crisis has shown us so painfully, not everyone can or should be a homeowner. We expect more municipalities will use their local funds for rental housing because MassDocs makes it easier. My organization recently committed $5 million, matched by state funds, to support neighborhood-scale rental developments where delivering funding through MassDocs is required. So we're starting to have a programmatic impact. MassDocs is not really a program as much as a new way of doing business, and the stakes are significant. In Massachusetts, state government controls more than $450 million in housing development dollars each year, and cities control tens of millions of dollars more. Yet none of these programs are sufficient to produce housing by themselves. Combining these resources in a simpler and more predictable fashion, as we've done successfully with MassDocs, will expand the impact of layered financing in ways that can be successfully replicated across the country. Thank you for considering MassDocs for this prestigious award. Joanne and I look forward to your questions.
Thank you. Questions, David?
I'm trying to understand if You've done about 5,000 units through MassDocs. Would they have probably all been done but more slowly without it, or would some percentage of them have not taken place without MassDocs?
They all would have taken place, but it would have taken longer for them to occur. And in the process, rather than have one loan closing attorney, there probably would have been 3, 4, or 5 assigned to that. So it's saved us both time and money.
Thank you.
Yes, Tony Williams.
As laudable as this is, and with the impacts that you say it has in terms of cost, in terms of time, just to be devil's advocate, why isn't this just good management that you get your, you try to create one-stop shopping, improve documentation and all that? I mean, come back at me.
Well, the system is fairly broken overall, and it emanates largely from the federal government. The localities are all given home funds, the state's given home funds, so right off the bat, we've got a bunch of, a lot of sources in the mix to try to put together, and we put it on developers to do that. Go figure it out and come to us, and eventually deal will get done. And that's not good enough. And so we need to do this. We need to use this as a platform to do more. We need to collaborate with the local government, as this is a great beginning for us. We need to stop messing around and really get at this problem. And I think that people are caught up in the complexity of the system. Again, there are a lot of people making a living being consultants.
You faced a lot of resistance from whomever and wherever as you did this?
Actually, people love this.
So all the agencies cooperated and you didn't have any pushback?
No, but there is a long history. We described it in our application around what it took to make simplification, this kind of simplification happen. It was, 15 years in the making, really.
Bill, and then Carl, and then Maria.
I guess I'm having a little problem seeing how replicable the program is, because it seems to me that Massachusetts has a fairly unique procedure. It's a pretty complicated, complex procedure involving a whole range of agencies and bureaus and so forth, which may not be the case, and other states have a much more simplified system. And I'm wondering if you feel that this is replicable as such, or needed as that way.
We think it is, because anyone who uses a system that's web-based for loan closing is going to save time and money, even if it's just one source of funding that's going into a deal. But I think nationwide, you'll find that there's not just one source of funding that's going into a deal. There are many sources, no matter where you are.
This is going to be applicable to any high-cost area, because most high-cost areas, you cannot use one source or even two to get a deal done. You need many. And so, yes, it's not going to be applicable to every corner of the country, but lots of states, lots of cities.
Carl?
I just following up on what Tony was asking, to me, the fact that the state can get all of its agencies to do the same thing doesn't strike me as all that innovative. But what I'm interested in is how the relationship between the state and the localities. And do now the localities that are participating, are they also using the same loan documents? And are they, to what extent are they buying into the state program? To what extent are they not?
Through MassDocs,
yes.
We're all joined at the hip in one set of documents if they join our program, and they are joining our program.
And Maria?
So from one perspective, this seems like a very, very good thing for developers. I mean, from just one set of documents, but it kind of goes back to David's question is that making it easier for developers? Does it really result in a greater number? Is it a less amount of time to get a project financed and groundbreaking, and that's really the measurable, is that you're shortening time and responding to need? Because eventually, presumably, even with 11 loan documents, you would fill them out if you want to do the deal. So
It's time, it's money, and I think eventually we've got some potential to get more done, because, again, as we get municipalities engaged, and it's easier for them, because, again, the local officials who came, they were all so excited that they only do a few deals a year. Mayors change, and they bring in new city solicitors, and they want to change the documents. They loved being able to join, to hitch to our wagon.
Yeah, and I think anytime you make the process more transparent and take care of either real or perceived issues in state government, that you've added benefit. And I think that's one of the things that MassDocs does, is that people know what it's about, they know that it's going to shorten the time, and that it's a predictable set of documents that are not going to be negotiated. They can go online, they can look at them because they're model documents on the website, so they know exactly what the procedure is going to be.
Yeah, yes. Briefly, please, Judith.
One more thing I'd add. I mean, we're hoping, through this we can start to really change the system. I mentioned in the application around trying to move developers more towards market opportunities. We heard from our friends in New York, we need an acquisition fund, largely because we don't have the resources available that can be assembled quickly enough to go out and shop the market. And we need to fix the underlying system so that we can have affordable housing developers, not these, sort of pathetic entities that only can buy the dog on the corner. They have to be able to get out in the market and get more good opportunities because we need the housing.
Unfortunately, our time is up. We thank both of you.
Thank you.
Ladies and gentlemen, we have reached our 15th. And we want to welcome here from the Yukon River Tribes the Solid Waste and Energy Management Program with John Waterhouse and Brian Hurst. And gentlemen, as you arrive, I will tell you that the concluding comment from our site visitor was how enthralled he was by the beauty of your part of the country. Welcome.
Thank you. I'm going to try a quick innovation here. It's really hot here in Boston. I'm John Waterhouse, and I have the great honor of being the director of the Yukon River Intertribal Watershed Council, which is an organization that was created in 1997 by the tribes, the sovereign governments of the 66 tribes and First Nations of the Yukon River. Through those years, a lot has happened. But to give you some context of where this happened, we're in an area where there are no roads, very little indoor plumbing as you understand it. We have honey buckets. Very little running water. Electricity costs are high. They're 98 cents to $1.27 a kilowatt hour. Huge problems out there. Just getting to the next village can be a challenge. In the winter, it's by snow machine and dog sled, and during the summer, it's by boat or airplane. So that's where we work and live. It's a subsistence area that's often forgotten by the rest of the world. I can give you an example of the Weather Channel. Have you ever seen Alaska on there? It's about the size of a postage stamp. That's not true. It's 2.5 times bigger than Texas. It's a huge area. It's forgotten by many places. So, through all these years since contact with the native tribes, it has also become a one-way ticket for dumping hazardous waste in the Yukon area. And these hazardous wastes come from mining, municipalities, and military, the 3 M's. It's pretty bad out there where we live. So, as the Watershed Council went along, with the guidance of our governments, our tribal governments, we decided to take it into our own hands to clean this up and preserve and protect the Yukon River and its entire watershed. That's 330,000 square mile area. We created something called the Backhaul Program, and we involved local governments, municipalities, our tribal governments, the federal government, and 22 companies, private companies. We brought them all to the table and created this program. We've removed over 6 million pounds of hazardous waste from the Yukon River watershed. Very successful program that's growing. At this time, though, we've taken it a step further. The state came to us and said, could you make this statewide? We said, of course. Heck, we're the people that went to the moon. We can do this. So we did. We are now working on a statewide level. The Russian government has now contacted us, and we are working with them to bring this program to Russia. Greenland, the same thing. We're working with them to bring it to Greenland. And the National Tribal Operations Committee of the EPA has taken it as a national priority for the lower 48 in the entire United States. It's a successful program that will continue, I hope, for, well, I would like it to end tomorrow. That means everything's cleaned up, but it will probably last the rest of our lives.
Thank you. Many government agencies actually don't or literally can't work in rural Alaska. The state of Alaska legislature does not recognize tribes, despite them being the first governments of this land. And as a result, there are many services that do not get provided, and we essentially fill that void. And Backhaul Program is one of our many programs, but it's really our wedge into the communities oftentimes. And it's a very concrete program. We literally pull up into a remote village of 200 people with a 150-foot barge or a C-130 cargo plane, and we leave with everybody's toxic waste. One of the real benefits of the program is actually we're often treated like rock stars when we come to the villages because we're going out with things that they don't want. And we improve their landfills. We extend the life of them. We have also spurred mobile solutions around recycling centers that are portable, antifreeze recycling centers, waste oil to energy conversion centers. We thank the partners by we produce a 60-second TV commercial that's aired every halftime program of the Super Bowl annually that recognizes all of the partners to the program who are providing over up to $1 million of in-kind donations with services. And broadly, clean water is really our organizational reason for being. And we go to the ends of the earth, from the Arctic Ocean and the Bering Sea all the way to the Charles River to protect and promote that. And we are guided by a 50-year vision that the tribal leaders and elders established when they first created the organization, which is to be able to drink water directly from the Yukon River as their ancestors did for thousands and thousands of years. And one of our leaders and elders who really established the organization is Pat Sweetser, who I'd like to recognize, who's in the audience here and has been with us from the very beginning.
Good. Thank you. Fascinating. Fascinating. Yes, please. We're going to have lots of questions. Carl.
I guess to both of you, but to Mr. Waterhouse, since he raised it, when you say that Russia and Greenland and other places are seeking to model programs after this, what aspect of this are they looking at with such interest? Is it the Backhaul Program, or is it something beyond that, or what?
I would say that's twofold. They are interested in the backhaul, but beyond that, they are very interested in our government structure. That people have told me, happily, that we can refer back to a book called Future Shock from 1970, that we're becoming quickly the hybrid of the bureau adhocracy that Alvin Toffler talked about in that book. Many of them are very clearly interested in how we can accomplish this on the scale that we have, and with 66 different governments involved. We're not as big as the United Nations yet, but we're working on it.
If I could add one thing to that. Oh, well.
The watershed that you're talking about, just to give me a sense of the scope, you're talking about the Yukon into Yukon Territory, or just in Alaska?
From the very headwaters in British Columbia through the Yukon Territory, and then it takes a left and goes to the Bering.
Including the tributaries into the river?
All of the tributaries of the entire watershed.
Okay, wow. Ooh.
If I could add one thing to that kind of combines both of the past questions, is that one of the things we've done in terms of our organizational structure is we've really challenged traditional jurisdictions and have sort of redefined boundaries around watersheds and recognizing where and how people are connected really for survival around clean water. And people in Canada as well as people in Alaska now essentially identify as a citizen of a watershed as much or more so than of any other sort of governmental entity. And that's really been one of our successes.
And my question would be, how unique is this to do I need to have like a, tribal situation in a Arctic environment for this to be applicable? Talk to me about the replication of this in areas other than, say, Greenland or Arctic Russia or Alaska. And I'm not saying that in a negative way.
I understand. Well, we are an organization in our guiding principles where we strive to become like an elder. And I say strive because we fail at times. And that's all inclusive. So along the way, we've created affiliated organizations agreement that includes municipalities. So we talk directly to municipalities, government to government, and a good example just locally for us is the city of Anchorage, which is very interested because we don't have recycling in the city of Anchorage, but we do in Bush, Alaska, and many of the other lower 48 municipalities, and then the other countries, same thing.
Yeah, David.
I'm going to try to sort of re-ask Tony's question, because some of us have been really struggling with this. We can clearly see how this would be replicable in Greenland or Russia, but in the lower 48, we already have watershed council type organizations in a lot of the lower 48. The Backhaul Program doesn't seem very applicable because the road system in the lower 48 is developed, and it's not in your area. So what is it about the innovation that is replicable in the lower 48?
Sure, and backhaul is sort of a word that we've come up with. It's within the shipping industry, but essentially what we're talking about is solid waste management, environmental stewardship, and recognizing how communities can govern themselves from the ground up. And so what we're doing is improving landfills, and that can happen anywhere. Reducing solid waste, making people aware of what's going into their landfills, of what their purchases are. And so it's in order to get to the bigger unit, however, we do that through this vehicle of clean water. And again, it's in terms of replicability, I think we all drink water and are dependent on clean water, and that's sort of a way that we can connect.
But all those things you described are already happening here. I mean, in my community, we do that stuff already.
And I would agree. In some communities, that's true. In many communities that we see, and on Indian reservations around the United States, that's not the case. And many of these materials now in this modern world are recyclable and valuable. It's similar to our energy program, where we're taking the used oils as a byproduct from our backhaul program and turning it into energy to heat village clinics. Or the materials, lead, when I started this program, was $860 a metric ton. It is now $3,000 a metric ton. Whoa. That certainly got the recyclers' attention.
Help me. And that's sort of like vertical integration of the whole solid waste, so that we are reprocessing and reusing all of the material that gets shipped out of the villages.
Yeah, I must say I'm terribly impressed by what you've done and what you're doing. I'm a little mystified. I have many mysteries you folks are helping to unravel for me today. One of the mysteries is you are citizens of the state of Alaska, are you not?
Yes, we are.
Why doesn't the state of Alaska, the state government, help you with dealing with hazardous waste and making sure your water is decently clean? I don't understand that.
There's somewhat of a disconnect between state and federal agencies and native tribes. That's where this started. At a lot of times it's been adversarial in the past. We probably remember our history about that. And government agencies really had struggled to approach native entities.
Have they?
Federal agencies?
Federal and state. We've provided that bridge.
Is this mostly federal lands that we're talking about?
No, state and federal, and tribal lands. And
Like
we've provided that bridge to federal and state agencies to be able to talk directly to the tribes in a way that they can understand. They had a terrible time with that.
Actually, on this, just if you were doing percentage-wise, what's the percent federal, state, and tribal?
In the state of Alaska?
No, where your watershed base.
It's probably, I'm throwing numbers out, but roughly a third federal, a third state, and maybe a third tribal, private. We have a very odd land tenure situation in Alaska that contributes to this, and I don't want to paint federal or state government agencies as totally inadequate, but yeah. So it's a combination of land ownership.
But it does seem to me there are other bodies that have some responsibility to their citizens.
Yeah. Well, you could argue. Do you capture any of your funding from the mine, if you can trace it back to those that polluted? I mean, the municipalities or the mines? I know you're getting some resources from the recycling, but do you go back to any of the commercial interests?
We haven't taken that step. We took a look around at the state of the watershed and the damage that had been done, and I say this kindly. We decided ourselves, rather than buy another attorney, another BMW, that we would take the action ourselves.
We need transportation too now.
that we would take the action ourselves to clean up the watershed ourselves and be an example to the rest of the planet.
Well, it's very clear why the site evaluator came back so excited about what you're doing. Thank you very much.
Thank you.
Yeah, right.
Right. I'm not going to get him a "Have you hugged your lawyer today" bumper sticker.
Yeah, exactly. So, ladies and gentlemen, this completes this phase of the competition. You've been very patient. Thank you for agreeing to sit, to present, to support others who are here from your communities. It's for those of us on this panel. This is a highlight of our year because it gives us an opportunity to really come to appreciate once again the sort of entrepreneurial spirit of somebody who work in government, who bring this sort of independent, we're going to go solve it. Yes, it's not working. Let's go solve it. And people come up with these very innovative approaches that often don't get a lot of attention much beyond the communities in which you live, but make an enormous difference in the lives of our citizenry. So for us, this is a day of inspiration as well as a day of judging, and it's just very warming to come here and to hear from all of you. And I know we all join in saluting all of you for what you're doing, for what you're giving back to the country. We appreciate it a great deal. There is going to be a reception, I believe, out in the courtyard. For all, Steve Goldsmith is shaking his head, and all of you are invited there. The judges are going to stay here for a few moments to fill out an initial ballot. What we do is everyone now fills out a ballot, and when we go to dinner, we sit down and see the collective results of how people have come out, and that starts the conversation. We can see, if there are some programs that there's a consensus around one way or the other, that helps a great deal. And then we pop open some wine and we have dinner, and we have a good old time trying to figure this out. And sometimes it goes late, and sometimes it does not. And 17-year-olds are not permitted to come. But the different judges have different views about talking to you all at the reception. I know everyone would like to say hello to you, but some judges feel it's sort of like an ex parte proceeding. Others feel, no, I need to understand this a little better. So please understand, if judges are not out asking you further, there are some who have this, or we don't have any set rules about this. We sort of trust everybody's judgment. But for the judges, we're going to be regathering at the faculty club, and I hope we can get proceedings underway. I know there are going to be people gathering over there before 6 or by 6, but the schedule says we should start by 6:30 with our proceedings. I think we should start promptly at 6:30. I do think that while we're here, Steve, you and your team deserve an awful lot of thanks. Do you want to say a word about that? Do you want to say?
I want to thank the people who did it, probably.
Yes, all right. But they do a superb job putting this together, and a great deal of work has gone into this. We're very proud to be hosts of this at the Kennedy School. The Ash Institute, Gower Risby, and Steve Goldsmith have been, and the staff. Where are the staff? Some staff here. Yeah, there. How many there? Yeah, they're here on the side. But please know, as you leave here, 1,000 applications, 15 finalists. We think all of you are winners, and we're very proud to be associated with you. Thank you.